Meantime, a broader population is newly eligible for the monkeypox vaccine in Rhode Island. Vaccines are now open to all Rhode Island men 18 and older who identify as gay, bisexual, or queer, or who have sex with men and transgender individuals and have had multiple anonymous sex partners over the last 30 days. That's along with people who are close contacts of someone with monkeypox. The Department of Health has identified 26 monkeypox cases in Rhode Island. However, they say the risk to most Rhode Islanders is low. 12 News reporter Alexandra Leslie visited one of the clinics that says it has a limited supply of the shot. She joins us in Providence with more.
Open Door Health is one of the local health centers offering the monkeypox vaccine in Rhode Island. Appointments are required as demand is high. I spoke with a patient getting their first dose and why they didn't hesitate to sign up.
Go for it.
This is JD. The 40-year-old from Providence just got his first shot of the Jynneos vaccine used to prevent monkeypox.
Relieved now that I have the first dose of it.
In addition to flu-like symptoms, monkeypox can present with a painful rash throughout the body. JD says since it's a potentially more visible disease, it sparked more fear among he and his friends.
Leaving permanent scars and disfigurement on your face and everything else. So I think people are more scared about that, to be honest.
Health officials say the virus can affect anyone, but people getting sick have primarily been men who have sex with men. JD is newly eligible for the vaccine in Rhode Island because he identifies as gay.
I have friends who've had it before or have been exposed to it too, so I'd rather protect myself.
Dr. Amy Nunn is executive director of the Rhode Island Public Health Institute, which launched Open Door Health, the state's first LGBTQ clinic in 2020.
Stigma perpetuates people not coming in when they need to, and we want people to know that they can come in and feel good when they get their care here. You know, a lot of people have been asking about vaccine hesitancy because of COVID, and that's not what we're seeing at all. I mean, we're seeing unprecedented demand for this service.
The Department of Health says Rhode Island has only been allocated close to 1,000 doses so far. Dr. Nunn says she's hoping the federal government can increase Rhode Island's share of doses to vaccinate as many eligible people as possible.
We want to have an early response. Our response to COVID was too slow. We need to respond quickly to this, and that's why this is so emergent. That's why it's so important.
Aside from Open Door Health, the Miriam Hospital Infectious Disease Clinic and Thunder Mist Health Center have received limited amounts of the vaccine. There are 2 clinics in Providence in the coming days, though appointments for those appear to be fully booked. We have more information about that on WPRI.com. Reporting in Providence, Alexandra Leslie, 12 News.